Hello, my name is Itzel de la Garza. I'm a student from Arizona State University. I'm in the class SPE 593 ABA Applied Project 2025 Summer B, Group ECI Erik Gallery. For my project, the title is Effectiveness of Functional Communication Training with 1 versus 5 icons in AAC device to decrease self-injurious behavior in a child with autism spectrum disorder. So basically, for this project, my rationale was to decrease the SIB, self-injurious behavior. And my patient, he is 8 years old. He was diagnosed with autism spectrum disorder, ASD, and he presents high levels of SIB. His SIB is described as any instance in which he uses his fists or open hands to um, go towards his push them towards his head. Sometimes he does it really rapidly, really fast, and it can create a lot of damage towards himself. For this study, it took place in a clinic that provides applied behavior analysis ABA services. So basically, my research question is, will the use of a single icon versus 5 icons in an AAC device decrease the frequency of SIB in a participant to get access to tangibles? So yeah, that's my question. And for previous research on the intervention. For the intervention, of course, I used functional communication training, but also it was a DRI. What does this mean? A DRI is a differential reinforcement of incompatible behavior procedure. So this consists on reinforcing a behavior that is non-compatible with the maladaptive behavior that we don't want. So in this case, we were reinforcing the client tapping or clicking the AAC device instead of pushing his hand towards his head. So it's a behavior that is not compatible. I can't be doing that or tapping while I'm engaging in hitting myself with my fists or open hand. So for the method, the design that I used was an alternating treatment design because this design it alternates two interventions. It can alternate two or more, but in this case, I also didn't want to use baseline. I didn't want to take baseline data more than once because SIB can be really dangerous for the client. And variables, the dependent variable was the SIB, and independent variables were two interventions. Intervention number one, that consisted on the client had to tap on the AAC device with only one icon. So the icon was play, and when he would press play, he would get access to anything. And intervention number two, it was the AAC device containing 5 icons: play, go, all done, more time, and eat. The client had to click on the correct one to get access to what he wanted. If it was not the correct one, we would redirect with a partial physical prompt, very gently, or a gestural prompt. Yeah. So basically, during the baseline procedure, the data was taken in a data sheet, and it was the frequency of SIB. So every instance of SIB that was occurring was recorded throughout 10 consecutive sessions, and it was 2-hour sessions each. And then we used other 10 consecutive sessions for both interventions, but it was alternating both. So it was basically intervention number one, it was in 5 sessions, and intervention number two, it was in 5 sessions as well, but it was alternating throughout the sessions. So for the results, as you can see here, during the baseline, the average frequency of SAB was 29.7, which was really high. And during intervention number one, the SAB decreased significantly, which was amazing. And the average frequency of SAB was 14.6, while intervention number 2 presented an average frequency of 19.6, which was really good. Both interventions had presented a decreasing trend, which was amazing to see. But intervention number 1 um, was a little bit more like, it was lower. It decreased the SIB a little bit lower because it was also, I would say that it was a response effort as well. It was only one click versus him having to um, go through all 5 of them and see which one was the one that he wanted. So, but it was really good for both of them. Discussion, yeah, basically the results for intervention 1 and 2 demonstrated the decreasing trend, as I mentioned before. And as we know, findings suggest that the use of functional communication with an AAC device is a successful intervention to reduce self-injurious behaviors in non-verbal children. So one of the main points that I have to point out here is that as future BCBAs, we need to understand that one of the main things for intervention for all of our clients is to give them their voice, to give them communication skills so that they can communicate with us what they need instead of engaging in these maladaptive behaviors. um, so it is a very important skill. It doesn't matter if it's AAC device through vocalizations or anything else. It is one of the main things that we need to consider with our clients. I know that one of the limitations for this study was that sometimes my sessions would overlap with like OT, occupational therapy, or speech therapy. So I had to stop them and then I had to redo them. So it was a limitation there. And for future research, I would recommend anyone who's gonna be doing something like this in the future to consider the time frame required for the completion of the study, and also to consider that it would be really cool to see the maintenance and the generalization of the intervention of the behavior that we want to see later on. So yeah, the timing mostly, and just to consider for self-injurious behaviors or any other behavior that would be like really dangerous towards themselves or someone else. It is important to choose a design that would not take baseline more than once. Yeah, these are my references: Cooper, Heron, and Hewart 2023, and Hodges, Falco, and Soares 2020. Thank you so much. I appreciate you guys listening. Thank you and have a good day.